Hi there, we're from the Regis Pathway. I'm Beth Overturf. I'm presenting with Claire Dalton and Ashlynn Castillon. Our focused question is, what is the effectiveness of individualized OT interventions in perinatal mothers to decrease symptoms of postpartum depression? So we were kind of given the green light to explore many interventions that OTs can use just because this is an area that's less explored. To begin our clinical scenario, postpartum depression is considered a major depressive episode or condition which can occur during pregnancy or postpartum in mothers, usually from 4 to 12 months after they give birth, but it can also happen like when they're pregnant. It happens in 1 in 8 women who have given birth, and areas that we can help them are building support systems, improving physical health, improving emotional, psychological health, establishing a smooth role transition, and advocating for them. All right. We can help also by helping with their scheduling and motivational techniques, which target occupational balance in the mother's roles, values, and beliefs. The scope of OT focuses on interventions emphasized in the role transition of becoming a new mother. All right, you can go to the next part. So the summary of key findings are that mindfulness interventions, exercise-related interventions, music interventions, and lifestyle education interventions are all successful working with this population. And I'd also like to note that all of our articles are 1A, 1B, and 2A and 2B. So we've got pretty good evidence there.
So a very broad overview of the clinical implications and the bottom line for occupational therapy, because we were able to just explore a lot of areas that we find these interventions and this patient population to be really relevant to the scope of practice of OT. For clinical and community-based practice, overall, as Beth mentioned, our evidence was very strong, and the studies all showed a lot of significant benefits to these particular interventions in decreasing the symptoms of postpartum depression. The strongest evidence was for mindfulness-based interventions, followed by exercise, music, and then lifestyle education. And the cool thing about all of these interventions is that they're very flexible, they're very creative, and they can work really well in tandem or adjunct to a traditional occupational therapy treatment, which makes them really flexible across settings. They can be used in an inpatient setting, an outpatient setting, home health, all of the above. And so there's a lot of benefits to implementing these sorts of interventions with this population. The different studies ranged in terms of the number of sessions, the length of the study itself. And so there was a lot of different timelines for the interventions and how they were implemented, both during the pregnancy and during the postpartum period. So we see a longevity of these outcomes, these positive outcomes. In terms of program development, again, just the flexibility of these interventions makes it very exciting to continue to explore the role that these interventions could play in occupational therapy. More research is definitely needed, and very encouraged through these studies. We've determined that more research would really benefit the scope of practice for occupational therapists. Societal needs primarily have to do with the secondary outcomes of postpartum depression. Women who experience postpartum depression are put at a higher risk for experiencing other mental health difficulties, some risky behaviors, and poor mother-infant bonding. Postpartum depression can also impact the child involved, and so some of those outcomes include social disorders, ADHD, obesity, and speech language disorders. In addition to that, as an occupational therapist scope of practice or just a lens, we would say that there are many, many occupations that can be impacted by experiencing postpartum depression. And for healthcare delivery and health policy, currently in the healthcare system, many women are discharged within 24 hours after giving birth. And according to these studies, a lot of the symptoms of postpartum depression show up some women during the pregnancy, but most after the pregnancy. And so it's really, really important to follow women after they've left the hospital setting and continue to provide care for those women who may be experiencing postpartum depression and continue to screen for those symptoms.
So in terms of education and training of OT students, at the student level, we recommend educating students on motherhood transitions and the therapeutic use of self, as it's super relevant to this population. For entry-level practitioners, we'd encourage them to explore these creative interventions that often aren't covered in the normal treatment plan of care. And then advanced level practitioners, we encourage to research and promote knowledge generation on these alternative interventions to further their use in practice. And then in terms of specialty providers like NICU OTs, just further education and curriculum and involvement in their part on signs and symptoms of PPD, just because the population of mothers that they work with, not just the babies, but the mothers as well, is a part of their care and also just something that they should be aware of. For the refinement, revision, and advancement of factual knowledge or theory, as Claire and Beth have both stated, we need further research in this area. The emerging support for these interventions is definitely super promising, but it's currently not enough to promote program development or policy change or use these as individual treatments, not as an adjunct with something else. And so we encourage further research at a higher level because it is important for the health promotion of mothers and just increasing the implementation of this and education in OT programs. Some of the limitations of the studies we looked at were the long-term efficacy, sampling bias or participation bias, unclear researcher blinding, research in another country, and just overall, again, more thorough research needed in this area. So thank you for listening to our presentation. We love doing this research and are happy to answer any questions that you have.